Hey guys, it's Jennifer. I'm from the Finding Peace blog, and I wanted to touch base with you today about my oldest daughter, Catherine. I started writing articles about her, and she's 22, so there's just a lot of detail in regards to her different diagnoses. When I wrote the About Us page in the introduction to my blog, I talked about the different labels that all of my kids had. Not just labels that my kids have, but also the labels that I have. I mentioned things in regards to the kids as far as epilepsy, seizures, ADHD, mood disorders, growth hormone disorder. And in regards to myself, being a mom of 4 children, 3 with special needs, I'm a licensed professional counselor, and I'm also a widow. And all of these different labels affect us in certain ways, in one way or another, and not just us as individuals, but our entire family. So I wanted to spend some time today just talking about Catherine, because Catherine's 22, and she's the one that really started my journey as a special needs mom. I often refer to her as my greatest teacher, and I've already written one article on my blog, findingpeace.com, about the early years in regards to her. And she received many different labels in the early years. We had many different specialists, a lot of questions, very few answers. In the article that I wrote, I already touched on some of her first diagnoses of failure to thrive. When she was 1 year old, she was only 12 pounds. When she was 2, she was only 24 pounds. When she was 3, actually when she was 2, I think she was like 18 pounds. When she was 3, she was 24 pounds. Because I remember when she was 3 years old, she still fit in size 18-month clothes. And her size has always been a concern and a symptom, I guess, that no one has really ever been able to explain. When she was 2, we did start her on growth hormone injections. The endocrinologist that we were referred to did not necessarily diagnose her with a growth hormone disorder. Her growth hormone was tested and was within normal limits, but on the low side. But due to her failure to thrive, they wanted to see if it would benefit her. So we did growth hormone injections every day for a year, and we did not see significant results due to those growth hormone injections. So we chose to discontinue them. They had said that we could always revisit that when she hit puberty, and perhaps the growth hormone injections along with puberty would help her grow. To jump ahead a little, when she did hit puberty, we decided not to go through with the hormone injections at that time. And honestly, even now, she's about 4.5 feet tall, maybe 120 pounds. And as a family, we decided that she was honestly easier to manage being a smaller size, and there was no benefit to her that we could think of to, number one, put her through daily injections, which she would not cooperate with. But also, number 2, we didn't see any benefit to her being bigger. As far as her daily functioning, as far as any of the functioning in her daily life, her growing would not benefit her in any way. At least that's how we as a family saw it. So when she hit puberty, we decided not to pursue growth hormone injections. When she was 3 years old, that is when we decided to do a G-tube. And it really wasn't a decision as a necessity at that time. She was often, because of her sensory issues, she was often put into the hospital for dehydration every time she got sick. So she would get a cold and she would stop drinking. And so, of course, get dehydrated. We would be hospitalized for dehydration so she could get IV fluids. And that happened a couple of times. So when the idea of the G-tube first was presented to us, it was as a, well, let's try this so that when she gets sick, she won't end up in the hospital. So she was actually hospitalized, and that's when the gastroenterologist said, let's just go ahead and do this. And we said, yes, definitely. And then, so the G-tube was inserted. When she was in the hospital, she caught something very similar to shingles around her mouth, down her throat. She was in a lot of pain, and that is actually when she stopped eating and drinking totally. So here we were with a G tube that was supposed to be just for something as needed, and it ended up being the only way that she was getting any kind of nutrients. So from that day on, when she was 3, she received 4 cans of Pediasure a day to help sustain her. It was actually another year before she would even start eating anything by mouth. And if you read my blog, you know that the only thing she has ever eaten since 3 years old is goldfish crackers and nacho cheese Doritos. And after about 15 years of goldfish crackers, she decided she does not want any goldfish crackers. And so her primary diet is nacho cheese Doritos. But since she was 3, she has not taken any fluids by mouth. We tried a variety of different things in regards to speech therapy, occupational therapy to assist with the eating. One of the biggest obstacles with Catherine is the sensory issues that she has, not just with her hands and her entire body, but orally. She is so sensitive orally to different textures, different flavors, and after going so long without eating regularly, she had difficulty knowing how to bite off a piece of food, how to chew food, how to move food from the front of her mouth to the back of the mouth. She used to do this little thing where she would just like throw her head back, and that was her way of getting food from the front of her mouth to the back of her mouth. She did not know how to use the muscles in her mouth to move food or to hold liquid or to hold different kinds of food in her mouth. That was a real struggle. In our area, we have a lot of good therapists, but we don't have a specific feeding program. The nearest one is about 4 hours away. Very good one, but it's a 40-hour-a-week program, and with 3 other kids, it just was not something that was an option for us to be able to pursue. So as a 22-year-old, she's still dependent on the G-tube. She now is moved to Ensure. She gets about 4 to 5 cans a day, and she supplements that with her nacho cheese Doritos. So that takes care of, let's see, I've gone over failure to thrive label, growth hormone label, feeding disorder label, sensory, I've kind of touched on. Again, her sensory issues, she's very sensitive orally, very sensitive with her hands. Even to this day, washing her hands, putting soap on her hands, anything on her hands is very difficult. Band-Aids, anything sticky. Teachers would always try to give her stickers as a reinforcer, and she hated them because she did not want to touch the stickiness. She did not like to feel the stickiness. Sensory-wise, again, she doesn't like things touching her face. So that's always been very difficult. And the sensory issues have affected all parts of her life. Taking a bath. She did not like the pouring of water on her. So showers when she was younger was just not even an option. And taking a bath, I would often lay her back on a bathtub to rinse her hair because she didn't like water being poured on her hair. She got better about that, but that was something that was really difficult. We tried to implement more showers because laying her down in the water often got water in her ears, and then we would have an increase in ear infection. So it was pros and cons. I mean, sometimes you're just always dealing with something. But her sensory issues affected her daily functioning skills. It affected her eating. It affected her hygiene, brushing her teeth. Even at 22, I still have to restrain her to brush her teeth. Now, she doesn't fight the restraint. Now, when I say restrain, I put a towel around her arms. At this point, she's just so used to it. In fact, if I tried to brush her teeth without the towel, she asks for it. So I think she knows that it helps her. And I also think that the towel being wrapped around her provides a hugging sensation or a deep pressure sensation that helps her to tolerate the toothbrush going into her mouth and me brushing her teeth. One thing I have learned through the years is she does not like minty toothpaste or strong flavored toothpaste. So I still often buy her the children's toothpaste, like a bubblegum mint or something with a much milder flavor. She doesn't seem to react as strongly to that as well. Another thing I do with brushing the teeth is, I didn't mean for this to be a video about brushing teeth, but since we're talking about it, is I count. I count to 10, and she even says, count to 10. And I think that provides a clear beginning and a clear end. So I count to 10 on each side that I'm brushing, right top, bottom, left bottom, right bottom, so forth. And so she kind of knows when it's going to be over. She doesn't fuss, she doesn't fight, she still doesn't like it, but at least we get it done. So some of the labels, again, sensory, feeding disorder, growth hormone, failure to thrive, speech delay, and that goes along with her autism. She was diagnosed actually with pervasive developmental disorder at the age of 3. We decided to go to the Marcus Center in Atlanta to get our diagnoses. Where we lived locally, there wasn't a lot of, and you have to remember, this is 19 years ago. Back then, the rate of autism was still at 1 in 1,000. So professionals weren't as perhaps knowledgeable, familiar, or willing to diagnose a 2 to 3-year-old with autism spectrum disorder. So in our search for answers, we went to Atlanta and we went to the Marcus Center, and we received actually 2 diagnoses. One was movement disorder, which we knew she had some gross motor issues and fine motor issues, but nobody had exactly pinpointed it as it being its own disorder, as well as pervasive developmental disorder, which eventually turned into autism, because I think that at that time, to be honest, we were given the PDD diagnosis because new psychologist, she was just graduating, and I think she was kind of nervous to give this young, new, stubborn mother and a straight out autism diagnosis, which I already knew she was on the spectrum at that point in time. I was just trying to get some things official, because as parents, and as you know, once you get labels, once you get diagnosis, that's how you access resources. The labels don't necessarily benefit us for explanations of things. All of our children are different. Labels help get services. And again, we were dealing with so many different types of symptoms, we weren't exactly sure what to focus on. So the labels really helped us just to kind of define Catherine and define what she was struggling with, so that we could get the services and the help that she needed to move forward. So Catherine was nonverbal till 5. She said her first word when she was 5 years old. Her first word was help. I would throw her on her beanbag, and I would say, do you need help? Because she didn't have the motor skills to get out of the beanbag. And she would kind of make a noise, or I think we were doing some sign language then, so help. And she would sign, and then I would just keep repeating it. And one day she said the word, and that was her first word, was help. And from that, speech has developed. It's if you've seen any of the other videos of her articulation is very difficult to understand. She usually just speaks in 2 to 3 word phrases, unless I tell her to speak in sentences. Most of her communication during the early years were just nouns. She didn't develop any kind of verbs or putting nouns and verbs together until she was about 9 or 10. So language was slow in developing as well. There's so many different things I feel like I could talk about with Catherine, because again, she's 22. So I'm just trying to give you this overview of who she is. Medication. Well, she did not start any kind of medication until she was 5 or 6. I think it was first grade, because she just entered school. And as a new parent, and her being my first child, I was very nervous about medication, especially giving medication to a child who is nonverbal. Someone who couldn't communicate to me how the medication was making her feel, or if it was effective or not effective. We made the decision to start medication in the first grade, honestly, because her anxiety started to increase and she started pulling out her hair. She literally had a bald spot. in the front of her hair. And we tried behavioral interventions to kind of reduce that at first, tying headbands, bandanas, trying to prevent her to have access to her hair. And none of that worked. And there was a pattern around that we would see an increase in that behavior around lunchtime. So, I went to her neurologist at the time and just said, look, she needs something. We just need to bring her down a notch so that the behavior techniques, behavior intervention has always worked with her, but because of this anxiety, because of whatever it is that she's experiencing, she needs to be brought down a notch so that the behavior interventions will work again. And so that's when we started our road with medication. I'd be happy to answer any kind of questions in regards to our experience with medication, but that's how we kind of made the decision to go on medication. And I won't go into details in this video about all the different medications we've tried, not just with her, but also with the boys. It's been very different journeys for all of the kids. Hers has actually been a lot easier because hers have been more consistent. The boys have been more trial and error, especially as they hit puberty. Testosterone's a whole new beast when it comes to medicating your kids or using medication as a therapy in treating the symptoms of autism. So that's Catherine through about the age of 10. And I think I will sum up the video here just because I feel like autism and puberty, especially in girls, is a whole nother topic that I could probably spend another 20 minutes talking about. And I have a very unique perspective having twin boys who are now about to turn 18 on the autism spectrum and a girl or a young woman on the autism spectrum who's 22. Autism is very different between boys and girls. Autism, when you hit puberty, is very different in male and females. And that is something that I think that is a subject for another video. So I hope that giving you this background on Catherine will kind of help you to understand who she is. I post a lot of videos of her and understand who she is and kind of what her journey has been through. And again, this is just an introduction of Catherine. I hope that I want to connect. I want to hear what your questions are. What are things that I can answer for you with my experiences having 3 on the spectrum and all of them being so different? What are the questions that I can answer for you if you have a young child or a girl on the spectrum? What are the questions that I can answer for you in regards to things that we went through in regards to puberty or as we go through this transition? One of the videos that I am planning to do is to talk about special needs trusts and guardianship and my experience with that as I became a widow, which is, again, a whole nother video. But becoming a widow definitely opened my eyes to a lot of things and things that I wish and knew in some way or another that I should have had in place, but hopefully can share my experience to help encourage you to have certain things in place just in case bad things happen. So, but until then, thank you for listening to me. Thank you for letting me introduce my Catherine to you. Thank you for letting me share. This is so, anybody who knows me knows that this is so outside of my comfort zone to be this transparent and to share so much of myself. But for some reason, this seems like the time that I needed to be doing this, to be reaching out to people and to share my story. So I appreciate you watching, and I hope that you visit the website, findingpeace.com. We're going to have some new articles up within the week. We have Instagram, Twitter, all your different social media outlets. Share, 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 like, and I will talk to you soon. Thank you.